Assalamu alaikum. My name is Dr. Anwar Khan. Today we will be talk about H. pylori or Helicobacter infection. What is the H. pylori? Symptoms of the H. pylori. When to see a doctor. Causes of the H. pylori. Complications of the H. pylori. Prevention of the H. pylori. Diagnosis of the H. pylori. Treatment of H. pylori. H. pylori or Helicobacter infection. Helicobacter pylori. H. pylori infection occurs when H. pylori bacteria infect your stomach. This usually happens during childhood. A common cause of the stomach ulcer, peptic ulcer, H. pylori infection may be present in more than half the people in the world. Most people don't realize they have H. pylori infection. A peptic ulcer is a sore on the lining of stomach. Symptoms of the H. pylori. Most people with H. pylori infection will never have any sign and symptoms. It is not clear why many people don't have any symptoms. But some people may be born with more resistant to the harmful effects of the H. pylori and H or burning pain in your stomach abdomen. Stomach pain that may be worse when your stomach is empty, nausea, loss of appetite, frequent burping, bloating, unintentional weight loss, when to see a doctor, severe or ongoing stomach abdominal pain that may awaken you from sleep, bloody or black tarry stools, bloody or black vomit, or vomit that looks like coffee grounds. Causes of the H. pylori. H. pylori bacteria are usually passed from person to person through direct contact with saliva, vomit, or stool. H. pylori may also be spread through contaminated food or water. The exact way of H. pylori bacteria cause gastritis or a peptic ulcer. Risk factor of the H. pylori: living in a crowded condition or living in a home with many other people can increase your risk of the H. pylori infections. Living without a reliable supply of the clean water. Having a reliable supply of the clean running water helps reduce the risk of the H. pylori. Living in a developing country. People living in developing countries have a higher risk of the H. pylori infection. This may be because overcrowded and unsanitary living conditions may be more common in developing countries. Living with someone who has H. pylori infection, you are more likely to have H. pylori infection. If you live with someone who has H. pylori infection, complication of the H. pylori, ulcers, H. pylori can damage the protective lining of the stomach and small intestine. This can allow stomach acid to create an open sore is called ulcer. About 10% people with H. pylori develops an ulcer. Inflammation of the stomach lining. Inflammation of the stomach lining. H. pylori infection can infect the stomach, causing irritation and swelling, gastritis, stomach cancer. H. pylori infection is a strong risk factor for creating types of the stomach cancer. Prevention of the H. pylori. If you are concerned about H. pylori infection or you think you may have a high risk of the stomach cancer, talk to your health care provider. Together you can decide whether you may benefit from H. pylori testing. Diagnosis of the H. pylori. Several tests and procedures are used to determine whether you have H. pylori infection. Testing is important for detection of the H. pylori. Repeat testing after treatments is important to be sure H. pylori is gone. Test may be done using a stool sample through a breath test and by an upper endoscopy exams. Stool test for antigen. The test looks for parents antigens associated with H. pylori infection in the stool. Stool for the PCR test, a lab test called a stool polymerase chain reaction PCR test can detect H. pylori infection in stool. The test can also identify mutation that may be resistant to antibiotic used to the treatment H. pylori. Breath test. This is called a urea breath test because your body absorbs the carbon. It is release of carbon. You belong into a bag. A special device detect the carbon molecules. This test can be used for adult and children over 6-year-old who are able to cooperate with the test. Scoop test. This test is included with endoscopy of the upper GIT. In this test, the healthcare provider examines stomach, duodenum. Your health provider may also take tissue sample biopsy. These samples can examine for H. pylori infection. Treatment of the H. pylori. Proton pump inhibitor PPI, bismuth subsilicates, histamine H2 blockers. Some of the homeopathic remedies: phosphorus, calcareous carb, nitric acid, bismuth, nux vomica, carbovich, bryonia, anacardium, robinia, and many more. Thanks for watching. Thank you very much.